Are you suffering with a painful shoulder that's also very stiff? It could be what's referred to as frozen shoulder. This is a very painful condition that is extremely sore and uncomfortable, especially in the first few months. Pain is usually present before the stiffness and lots of range of motion kicks in. People who suffer with this condition have severe pain, not only in movements but also at rest. Sleeping is affected and it's very easily irritated. It's immediate pain when you try to move it, and it hurts doing everything. The pain is generally more widespread than people realize. It can hurt all over your shoulder and down your arm or up into your neck. It's difficult to get any relief in the early stages, and you can feel that nothing is working. So excruciating pain in all tasks, with pain also at rest, unable to sleep, extreme pain if you move it suddenly, around the age of 40 to 60, with maybe not much physical activity, being a smoker or diabetic, the suspicion would be extremely high that you have frozen shoulder. But you can also have it without ticking all of those boxes, which I will explain. Hi, my name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Dublin. In diagnosing frozen shoulder, an X-ray is recommended to confirm it and also rule out other pathologies. But an MRI scan will be better at ruling out other potential issues. What we see in clinic is significant and equal loss of range of motion in active and passive movements. So two movements you can test are lifting your arm up and also moving your arm outwards. You should be stiff and sore with a reduced range when compared to the other side. You might also be quite reluctant to move it as it causes a lot of pain. There are lots of reasons why the shoulder can become stiff and painful. One of these is when the tissues are responsible, like muscles and tendons, and that's what we're talking about in this video. Frozen shoulder can sometimes be referred to as adhesive capsulitis, but that's a bit misleading as there are no adhesions. It was used in the 1940s, and the term has stuck around ever since. It was thought that the capsule was stuck to the head of your shoulder, but nothing is stuck to anything. The capsule does, however, become inflamed. The medical world has not yet figured out why this happens. There seems to be multiple causes, and the triggers vary from person to person. The inflammatory process causes the shoulder capsule to thicken and stiffen and contract around your shoulder joint. So your shoulder becomes painful and very stiff. The issue is most common between the 40 to 65 age range, but you can have it outside of that age range as well, and it affects more females than males. I've mentioned the textbook presentation of frozen shoulder above, but like I said, several things can trigger a person getting frozen shoulder. If you have metabolic diseases like diabetes or cardiovascular disease, inflammatory issues like chronic inflammation or rheumatoid arthritis, there can also be a genetic component to developing frozen shoulder. A shoulder trauma can trigger the subsequent development of frozen shoulder. So if you've had a fall or you hurt your shoulder in some way, as well as generally low physical activity, so not putting your shoulder through enough range of motion or not stressing your shoulder enough. Shoulder surgery or having another shoulder pathology can also trigger the development of frozen shoulder. So you can see there are a lot of potential triggers, generally a mixture of lifestyle, genetics, medical history, trauma, activity levels that can contribute to frozen shoulder. This condition can last a very long time, in some people for several years, so expectations do need to be managed from the start. The less risk factors you have, so having a positive attitude, a healthy lifestyle, plenty of activity, no other diseases, can mean you resolve this quicker than someone with several of the risk factors we just mentioned. It often goes through two stages. One is when it's more painful than stiff, and then this is what often causes people to seek treatment, as they have consistently sore shoulder that prevents them from living a normal life, often can't sleep at night. It progresses to a stage where the restriction and the lack of movement is the bigger issue, when it's more stiff than sore. The pain has reduced, but they don't have the movement back, and they struggle to reach overhead or put on clothes, etc. Managing this on your own doesn't work out well for most people. Contrary to popular belief, it doesn't always resolve within 12 to 18 months for people. It can also be very difficult to cope with if you don't understand how to manage it. So some help from a competent, supportive physiotherapist can lessen the suffering and help you to make progress. It's not a condition where you need to lie on a physio plinth every week. That should never really be happening for anything, to be honest. But getting a session on a monthly basis or every 6 weeks can help with your recovery. How to manage frozen shoulder. The evidence-based treatment approach comprises of 3 things. 1, advice and education. 2, encouraging movement. And 3, resistance exercise. In terms of advice and education, your questions need to be answered and you need to be reassured. The main thing is that even though it's very disruptive in your life, it's awful, but the serious pain and stiffness does not mean serious damage or sinister pathology. You are going to get better and there are many ways to help, but there are no quick fixes for this. You need to be shown all the things that you can do to help yourself. Sometimes steroid injections can help, especially when it's very painful. Physiotherapy helps, and the issue doesn't require surgery in the vast majority of patients. You can see some of the exercises used in early self-management with gentle exercises, trying to encourage movements and low-level strength work, but increasing general activity as well as lifestyle modifications like stress management also needs to be discussed. When the pain reduces and the stiffness is more the issue, you can step up the level of rehabilitation and resistance exercises. Static stretching isn't nearly as effective as most people think, but the resistance exercises used to help frozen shoulder could be called stretching with a weight involved. Heavy, slow, eccentric exercises, like the ones you can see here, increase joint range of motion and improve strength and tissue length. You can do these sessions 3 days a week and see an improvement within a few weeks. Just remember that these exercises are only to be used when it's less sore. Do 3 sets of 5 to 6 reps, 2 or 3 days a week. I hope that has helped. If you have any questions in relation to frozen shoulder or your own shoulder pain, please feel free to reach out, comment below, we'd be happy to help. And if you like this content, feel free to like and subscribe. Thanks.